By Billy Cunningham, the Great American. Over the past year and a half to 2 years, there are many that have not had proper screenings to prevent future diseases, whether it's prostate or breast cancer screenings, those kinds of things. People have been reticent about going to the hospital, going to urologist, or going to proctologist, or going to gynecologist, whatever it might be. And Cincinnati urologist Dr. Gary Kirsh is about the best there is on these issues. Plus, we want to talk about the proposal that all men over the age of 40 must get mandatory vasectomies and more. And Dr. Gary Kirsh, welcome again to the Bill Cunningham Show. And Dr. Kirsh, how are you?
Good, sir. Thanks for having me.
Three issues are percolating. Number one, about a week ago, we had President Bill Clinton had a UTI, which I thought women had UTIs, urinary tract infections, more than men, but he spent 6 days in the hospital. How normal or common are UTIs among men?
Well, they're not as common as they are, as you suggest, in women, but they are not completely uncommon in men, especially men who are older. And as you know, President Clinton's in his 70s, and when men get a little older and their prostate starts to act up and maybe their bladder doesn't drain as well as it used to, then bacteria can grow in there and then get in the bloodstream. We don't know exactly what happened for sure to President Clinton in that regard, but that's how it often happens in older men.
How does a man or a woman stop these things from happening? What do you got to do, if anything?
Well, sometimes, you just can't do anything. But if a man has urinary difficulty, trouble urinating, weaker flow, and so forth, they may not be draining their bladder properly. And then you have a reservoir in there that's not draining. It's like a stagnant pond. A little bacteria get in there, and it's not draining, like a stagnant pond. And then the bacteria grow in there, and then they get in the bloodstream. So if a man has a lot of urinary difficulty, symptoms, waking up too much, poor flow, then they want to get checked and make sure their bladder is draining.
Is there a pill to make that happen, or what do you do?
Yes, sir. There are pills that we use to encourage bladder draining. Very common pill called Flomax. Probably half your adult male listening audience that are over 60 have heard of it. And then there are multiple procedures that can be done when the bladder does not drain properly.
Now, secondly, we had a request about a week ago that men over the age of 40 with 3 kids have a vasectomy. I would have thought that kind of stuff would be impossible, but in today's world, almost anything is possible. Is that a good or a bad idea?
Well, I don't think we can compel people to have vasectomies. I did see this. This was, I don't know if it was tongue-in-cheek, but it was a legislator in the state of Pennsylvania who said we ought to force men to have vasectomies if we're going to have regulation of abortion. I don't get into the abortion issue. It's none of my business. But as a urologist, I don't think we can force people to have vasectomies.
What happens when you have your tubes tied, your vas deferens, that thing is tied? What happens to the fluid that should be going out and staying in? What happens?
Well, I'll tell you, most people don't realize that of the ejaculatory fluid that comes out when a man has sexual relations, only 1% of the volume of that fluid actually comes from the testicles, which are blocked by a vasectomy. 99% of the fluid comes from the prostate and another organ called the seminal vesicles. So when we block the vas deferens with a vasectomy, men do not notice a change in their fluid output with sex.
Is there, if you're in your 40s or 50s, 60s as a man, is it always a good idea to have your partner understand that there's certain medical requirements of the evacuation of your seminal fluid? It's kind of like a duty of the wife to do such things. Is that an argument that one could make?
One can always make an argument. An argument may not be accepted, sir, by the partner.
And the other thing is, if you're a monk, for example, and supposedly never have sex, they seem to live forever. So maybe not having sex is a good thing.
I don't think we can correlate longevity with sexual relations. I think that we should have sexual relations with consensual partners as much as we'd like.
All right, now lastly, what about the prostate screening and that kind of stuff? Have you noticed in your business, Dr. Gary Kirsh, that fewer and fewer men are being screened for prostate cancer because of the COVID-19 epidemic?
Yes, sir. We had a problem, and hopefully we're coming out of it now, but it's been documented publicly, not only with prostate but other cancers, that the various shutdowns and the general sense that older people should stay home and not seek care has led to a decreased screening for prostate cancer and an increased incidence of more advanced cancer that has been found. So we are now emphasizing, now that we seem to be doing better with the pandemic and doctors' offices are, of course, fully open, that people should get back on track. Many people miss their yearly visit, maybe not even on the prostate, maybe on their blood pressure. People need to get back on track with preventative care.
And lastly, as far as the prostate, what month is National Prostate Month? Isn't there a month dedicated to the prostate?
Yes, well, there's a couple of them. The one coming up is in November, and we call it Movember, and that's the No Shave November. That's a month where a lot of men decide to grow a beard in solidarity for prostate cancer.
Now, lastly, at what age, I have an older producer, Dave, at what age do you stop testing for prostate because you'll die of something else?
Well, I mean, I don't know. I don't think we stop testing until maybe men are in their 80s, because even in your 70s, an aggressive prostate cancer could affect your lifespan. Now, we don't have to check maybe as often, or maybe if you have a very low PSA number and it's very unlikely, maybe you don't need to be checked again. But I wouldn't put my head in the sand until I was probably 80 or so.
Do you have any questions for me about sports, politics, world capitals, something that's confused you over the years?
Yes, I would like to know what is the probability that our UC Bearcats will get into the playoffs, or whether the swamp of BCS football will deny them the opportunity.
Look at it this way. Unless something dramatic happens, Atlanta, I would say in Atlanta when they have the SEC championship game, I would have to think Georgia and Alabama are in. If they both are undefeated going into that game, both teams are going in. That's two places. I'd have to think the Big Ten champ is going to go in, because Michigan plays Michigan State tomorrow, Ohio State. Whoever the Big Ten champ is, that's number 3. It looks to me like UC might be fighting Oklahoma. That looks terrible. But I think if UC wins out and also beats SMU, which is a ranked team, they're going to be the 4th team over Oklahoma. What do you think about that?
I'm going to take that to the bank.
Dr. Gary Kirsh, I think your phone number is 513-662-022222. Is that correct?
It's close enough. You can look us up online, urologygroup.com.
Dr. Gary Kirsh, give my best to Dr. Alan Cordell. He's the best there ever was.
Yes, he is. I saw him just the other day. I'll pass it along. Thank you.
God bless America. Thank you, Dr. Gary Kirsh. Thank you.